Okay, so this is your cheat sheet for your NSAIDs.
Okay.
Okay, so I'm going to go over very briefly, just like everything that NSAIDs cause, and then we'll go into each drug.
Sounds good.
Okay, thank you. I like y'all's enthusiasm. Okay, so let's start at the top where it says no. Like, what are things you do not take with NSAIDs?
Yes.
No warfarin. Why would you not take warfarin with NSAIDs? Warfarin is a blood thinner, and NSAIDs cause platelets not to stick together, right? So that can increase your risk of bleeding. Why would you say no alcohol?
Because alcohol is toxic to the stomach and...
Well, I can agree with that. Alcohol is rough on the stomach, and all NSAIDs can cause stomach bleeding because they block COX 1. Okay. Because remember, COX 1 is the good one and it blocks it, so it can cause stomach bleeds. Okay. No glucocorticoids. What do glucocorticoids end in?
Solone or Sone.
Solone or Sone. And why would we not take glucocorticoids with NSAIDs?
Because glucocorticoids just tell like the whole body to like calm down.
But that sounds nice if we already need anti-inflammatory, right?
Yeah.
Glucocorticoids are toxic to which 2 organs?
Your
liver and stomach. And so glucocorticoids can tear up your stomach. And why would glucocorticoids tear up your stomach and cause stomach bleeding? What are glucocorticoids? They're synthetic what? Cortisol. We know cortisol. What's function number 11 of cortisol?
Oh, increase acid production.
It increases acid production, so that's why it can irritate the stomach lining. Corticosteroids can cause your patient's stomach to bleed. They must take it with food. That is always on exams. Okay. You must take corticosteroids with food. Do you understand?
Yes.
Okay, it's coming for you. All right, do not take ibuprofen with ASA. What's ASA? Aspirin. Why would you not take ibuprofen and aspirin together? What's ibuprofen?
Ibuprofen is anti-inflammatory.
It's an NSAID. Remember, anti-inflammatory is not real, right? That's something we made up. Okay, so ibuprofen is a NSAID. Aspirin is a NSAID. They're both toxic to 2 organs. You don't want to take 2 of those together, right? You're going to cause bleeding too. Yeah? Yes. All right. All NSAIDs are kidney toxic. Y'all quit looking at your papers. All NSAIDs are kidney toxic, which means I need to draw.
Yes.
BUN. Creatinine. GFR. Report.
Ringing in the ear.
Tinnitus, right? Because anything that's toxic to the kidney is toxic to the ears. Okay, so kidneys and ears. We're going to do a daily weight. Why would I do a daily weight?
Fluid volume.
Can cause fluid retention if it's toxic to the kidneys, right? Why am I monitoring their blood pressure?
Because it's kidney toxic.
It's kidney toxic, and so it can cause hypertension. Yes. So in our NSAIDs, do you want to give a bunch of NSAIDs to somebody with hypertension?
No.
Because it causes fluid retention, right?
Yes.
All right, you have to be careful giving NSAIDs. Caution with doesn't mean contraindicated. Contraindicated means you cannot. Caution means like, I can, but I got to be real careful. All right, so I'm going to give y'all drug class. You would be careful giving with NSAIDs, and you're all going to tell me why. Be careful giving NSAIDs with lithium.
For toxicity?
What are your 2 keywords for lithium? What is lithium? Oh, maybe that's a problem. What is lithium?
Metal.
I am deceased. Are you not in psych? Ma'am?
Anti-CU?
No. Y'all. Help us. What is lithium?
Something to do with serum or no?
No. Antidepressant?
All right, lithium, write this down because I'm not going to tell y'all again in this class. Okay. You will see everything interact with lithium, and this is why. First of all, lithium is a mood stabilizer. Okay. If y'all have... Okay, Marby, you need to go back and do the psych farm. Again, because y'all are going to have a lot of psych drugs that all this stuff interacts with. Okay. So lithium is a mood stabilizer. We use it for bipolar disorder. You have 2 keywords for lithium. Does anybody know what they are? Kidneys and salt. What are your 2 keywords for lithium?
Kidney and salt.
Lithium.
Kidney and salt.
Lithium.
Kidney and salt.
So it's toxic to the
kidney.
So are NSAIDs. So you probably don't want to give both of those together, yes?
Yes.
Okay. Why would you be careful giving NSAIDs with ACE inhibitors?
Because of your heart hypertension.
Ma'am.
Oh.
What do ACE inhibitors do?
They relax your heart.
No, ma'am.
They're toxic to the kidneys as well.
ACE inhibitors are kidney drugs. So are ARBs. We just did this like a week ago. These are kidney drugs. ACE inhibitors end in Pril. ARBs end in Sartan. They're both kidney drugs. What do they make you do? Pee. So if these are hard on the kidneys, you don't want to give NSAIDs because then you're trying to make somebody pee, and also you're going to be holding in fluid, and that's going to really mess with their fluid balance.
We use ACE inhibitor to treat hypertension.
Mm-hmm. We do. Okay. You also want to be careful giving any NSAID with another NSAID because you're looking at stomach bleeding, kidney toxicity, all of that stuff, right?
Yes.
All right. We know that NSAIDs are GI toxic. Why are NSAIDs GI toxic?
Well, GI is your stomach.
Mm-hmm. Why are they toxic to the stomach?
Because of the COX.
Because they block COX-1, which is protective of the stomach, right? So you may see if you give NSAIDs, they can get PUD. What's PUD? I hope it's not pelvic ulcers. That would be horrible. Peptic ulcer disease. They can cause ulcers down in your stomach. Okay. They can perforate your stomach and cause a hemorrhage. They can cause massive GI upset. So NSAIDs, everybody look at me when I say this. You have to take them with food. What do you do with NSAIDs?
Take with food.
Take with food. What do you do with glucocorticoids? Take with food. They're going to tear up your stomach if you do not take them with food. They should never be taken on an empty stomach. Are we clear?
Yes.
All right. If you're taking an NSAID and you have to take it, but it's causing GI upset, and you took it with food, you can give them a PPI with it. What's a PPI?
Proton pump inhibitor.
And it decreases
Yeah,
acid. So proton pump inhibitors, and they all end in pruzol, not azole.
No,
Pruzol, because our azoles are antifungals. Our pruzols are PPIs.
Yes.
Do not give NSAIDs with corticosteroids. How come?
Because
They both tear up your stomach. Have I made this clear enough?
Yes.
All right. So when you tell a patient to take an NSAID, they either need to take it with food, milk, because milk coats the stomach, which I find absolutely disgusting, but they'll say that, okay? Or a full glass of water to make sure that that NSAID is not just sitting on your stomach lining, because it will ulcerate and it can form a complete perforation, especially aspirin. Aspirin is notorious for causing GI bleeds. Okay? All right. So, cheat sheet. MI and stroke. Why would NSAIDs increase your risk of MI and stroke? Oh, get out that the inflammatory sheet that we just did. Y'all need to keep that out for the rest of the remainder of the time.
Okay.
So y'all give me the rationale as to why NSAIDs might increase your risk of MI or stroke. Huh?
You said okay.
Why would NSAIDs increase your risk of MI and stroke?
Because
And I need something specific.
Yeah.
Okay.
Well, because if it blocks the COX-1 and the COX-2, it's going to bring out like the thromboxane and the prostacyclin.
But it will block all of those, right?
Yeah.
But even then, you're right. Go ahead.
Well, with the MI, since it like prevents, I don't know where I'm going with this.
Okay, so I'm going to tell you, and then you guys are going to tell me back.
Okay.
Okay, so go back to your inflammatory sheet. These drugs, NSAIDs, are COX blockers. They are blocking COX-1 and they're blocking COX-2, which means everything underneath that in that cascade is also going to be blocked. Remember, I told you that thromboxane A2 and prostacyclin do opposite things.
Yes.
Okay, so in one way they are vasodilating and the other one's vasoconstricting. And one way they're causing the platelets to aggregate, and the other one they're causing them not to. Yeah. Okay, but they're blocking that, so it's going to end up being opposite that, right? Okay, but anyway, so in MI and stroke, it would increase your risk because it doesn't allow it allows the platelets to stick together, yes. Okay, because it blocks one side. So you'll see if you go to the NSAID cheat sheet, okay, look down where it says it can increase your risk of MI and stroke. Now look straight up, go all the way up to the top of the page. It also increases your risk of bleeding and clotting, Do you see that? That's because it blocks prostacyclin and thromboxane A2, which do opposite things. Do y'all see what I mean? Okay, so it can increase your risk of MI and stroke. So in patients taking NSAIDs on a daily basis, okay, we need to have them report sudden chest pain. What could sudden chest pain mean? MI. They need to report a sudden severe headache. What could that mean? That's a stroke. And we cannot have them do a cabbage up to 14 days after their last dose of NSAIDs. Remember when we were in cardiac and we talked about a cabbage. What is a cabbage?
The coronary
artery bypass graft. It is a giant, huge open chest surgery. Yes. Do you want them taking something that increases the risk of clotting and bleeding during a surgery? No. And this is often on exams.
So you would you would tell the patient to wait 2 weeks before coming in to do the procedure?
Yes. So usually a cabbage is elective. Usually it's like you have to schedule that because it's a big surgery. Okay. So they will say, hey, we're going to do your cabbage. We're going to schedule it for 2 weeks out because I see you take daily aspirin. Okay, so if they take daily aspirin, we tell them to stop that 14 days before the surgery so they don't bleed out or clot on the table.
So what if because sometimes they come into the ER
Mhm.
and you like try to rush them to the back, like if they're having a stroke, then what would you were still like it would be like the risk over the benefit?
Yes, it's risk versus benefit.
Okay.
Okay. All right. NSAIDs cause fluid retention. Why do they cause fluid retention?
Because they're hard on the kidneys.
They're hard on the kidneys. Now, these three do not give lists. These are often on exams. Do not give NSAIDs to asthma. Do you want more fluid in the lungs of an asthma patient? What about CHF? Do you want more fluid on a patient with heart failure?
No.
What about COPD? Do you want more fluid in the lungs on that patient? So those three patient populations, this is very, very often tested on. Do not give NSAIDs to asthma, CHF, or COPD. Are y'all with me?
Yes.
Okay. NSAIDs cannot be given in pregnancy, and they cannot be given to babies. Okay. One thing, they are COX blockers. Okay. That's one thing, but they can prolong labor and make it last a whole lot longer, because in order for that baby to come out, the baby has to get a message, something is wrong, and form prostaglandins to tell the baby exit.
Yes.
If you're blocking the prostaglandins and you're blocking that response, the baby's like, I'm gonna be chilling in here for forever, right? Because nothing's wrong. I'm happy in here. Okay. And we don't want that for these moms. NSAIDs also close the PDA in infants. What is a PDA?
It's the opening.
They're in all newborn babies, every single baby. They have what's called a PDA, a hole in their heart, and they have to have it to survive. It is called a patent ductus arteriosus. What does patent mean?
Closed.
Patent means open. Okay. Ductus.
The duct.
A duct, arteriosus. That's not a hard one. Artery. There is an open duct between their two main arteries. Where are the two main arteries in the heart? What are the two big arteries? Huh?
Like
Aorta and the other big one.
Pulmonary.
Pulmonary artery. So there in patients, in all newborn babies, there is a PDA. You see this little guy right here that
That's the
circles?
PDA?
Yes, this is a PDA. It is an opening between the aorta and the pulmonary artery. The reason why all babies have to have that opening is because when babies are born, or when they're in utero, they don't have any blood flow in the lungs because they don't need it. They get all their oxygen from their mom. So as soon as they take that first breath, they need blood flow to go to the lungs. So that hole is there to allow blood flow coming out the aorta to go into the lungs. But NSAIDs close that PDA. So what would happen to that baby? Oh, they're not getting blood flow to the lungs, and that's a big problem in a baby, is it not?
Yeah.
So that's why we do not give, even like ibuprofen. You'll see like children's Motrin, you can't give it till 6 months.
Yeah.
Okay? Because I don't want that baby.
You can, close.
It'll close their PDA, and then we've messed up everything. Okay? All right, now let's look at the top. NSAIDs can also cause bleeding. So you need to monitor their H&H. Report black tarry stool. What is black tarry stool called?
A GI bleed.
But what's it called?
melena.
It's called melena, and that means that there's an upper GI. Where's it coming from with NSAIDs?
The stomach.
Their stomach. Okay. You need to monitor for anemia. Now, remember, a GI bleed is not a red flag unless they're gushing blood out their butthole. Okay. But it is something that we do have to watch for.
Yeah.
Okay. Be cautious giving NSAIDs with warfarin, because warfarin is a anticoag, and then NSAIDs can cause you to bleed. Now, let's go down to the bottom. The big red things I put stars next to. Do not take alcohol with NSAIDs because it will tear up your stomach. Do not give to kids with chickenpox or influenza, especially aspirin. Remember, aspirin is not supposed to be given to kids under 18
Oh, wow.
because it can cause something called, anybody know what it causes in children, why we don't give aspirin to kids? No, but it's close to that. Reye syndrome, Reye, and that causes neurotoxicity, and it causes their liver to go bad, and there's no treatment. So no children under 18 are supposed to get aspirin. This is often tested on, okay? We do not give aspirin to kids. Do y'all hear me?
Yes.
We do not give aspirin to kids. And now, if they've recently had chickenpox or flu, it puts them at risk of Reye syndrome way even higher. Okay? Do not give NSAIDs with warfarin. I've said that 3 times now. If y'all get it wrong on the test, that's on you. Okay. We are going to discontinue NSAIDs 1 week prior to any surgery. Now, if it's a cabbage, it needs to be 2 weeks. Okay. The only exception to that rule is low dose aspirin if they're taking it for heart health or something.
Like the 81 milligram?
The 81 milligram, yeah. Do not use before or after a cabbage because you're either going to clot or bleed.
Yeah.
Right? So they need to hold the NSAID how many days before a cabbage?
14.
14 days. Do y'all understand the cheat sheet?
Yes.
Okay.